The treatments for breast cancer have changed over the last few years, and of course it depends on the type of breast cancer and how aggressive it is as to how it's treated. In this month's Prescription Arkansas report, Ann Jansen reminds us that one size fits all definitely does not apply when it comes to treating breast cancer.
Hey, how are you? It's good to see you.
Good to see you.
How's your life going?
Good.
Good.
Amy Harris comes in for periodic checkups with oncologist Dr. Larry Mendelson, even though she has completed her treatment for breast cancer.
I was just scheduled for a routine mammogram, and the night before discovered that there was a lump that had not been there. And so when I went in for my mammogram, I pointed it out.
In the days that followed, Dr. James Higgins performed a biopsy and surgery. Both confirmed how serious her situation was. After surgery, Dr. Mendelson discussed options for hopefully keeping the cancer from coming back.
Well, Amy fit a fairly aggressive situation in terms of her risk. And when we look at someone like Amy, who was young, she had 3 positive lymph nodes, her tumor was estrogen negative, and when you look at that situation, it just yelled out, gosh, we need aggressive postoperative treatment here.
So, based on those factors, Dr. Mendelson prescribed a combination of drugs.
We have new drugs for chemotherapy for those women that have very high risk, and there is yet another drug, a new drug called Herceptin, which is an antibody. All of those drugs can be used to help prevent recurrence. In her case, the drug Taxotere, we added to our old regimen of 2 drugs, adriamycin and Cytoxan, and while the side effects were increased, as you would expect with the addition of another drug, the advancement to cure rates have increased dramatically.
And Amy is proof. It's been 3 years, and she's still cancer-free.
Amy's been one from the start who just said, you know, whatever you need to do, let's do it. I got my life to go on with, and man, has she ever done that.
I feel very healthy and fine, and it seems like it was a lifetime ago.
Ann Jansen, today's THV.
Dr. Mendelson says if you're meeting with your oncologist to discuss treatment options and you don't clearly understand what he or she is talking about, call back and ask questions until you do understand. Now for our Prescription Arkansas survey, we asked 500 Arkansans, did you know there are different types of chemotherapy drugs? 74% said yes, 24% said no. The survey has a margin of error of plus or minus 4%.